Speaker.
I call the Honourable Dr. Ayesha Verrall.
It's nice to hear that speech by David Seymour, a man who has many bad ideas, but I'm not convinced this is one of them. There are many... at the heart of the issue of medicines regulation lies the issue of patient safety. And it is important to recognise how important it is to New Zealanders that Medsafe and international regulatory organisations focus on that, ensuring the safety, quality and efficacy of our medicines. Medsafe has a rigorous assessment process that protects public health by preventing the entry of unsafe and ineffective medicines to New Zealand. I am not as rosy on the look of the history of medicines regulation as the Minister was. When I look at New Zealand's history and around the world, there certainly are examples where medicines regulators have not got it right. We should never forget that. The example that was important in the early part of my career was Verrall, asthma medication that caused children's death. However, in New Zealand and around the world, there are regulatory bodies that do a good job of assessing the science, the data, and making sure that medicines that are available in markets are safe. And Medsafe New Zealand has achieved that, but so have many others around the world. And for that reason, Labor will support this legislation at its first reading so that these important issues can be considered at Select Committee. The Minister was right to point out that the verification pathway is the focus of this bill, but also already exists to some extent, the ability to use data from overseas medical medicines regulators. That's Section 23 of the current Medicines Act 1981. This bill introduces a new pathway based on recognition of full authorisations from 2 trusted overseas regulators. It could represent an improvement by reducing the duplication of regulatory effort and potentially speeding up the availability of medicines in New Zealand. Of course, we commit to taking the time in Select Committee to checking that there are adequate safeguards and particularly mechanisms for Medsafe responding to promptly if safety concerns arise overseas. It's important that detailed requirements and conditions attached to medicines approved by this pathway are clearly set out in secondary legislation and regularly reviewed. I'm thrilled by the Minister's enthusiasm for alternative prescribers, including nurse practitioners, but many others. It is a shame that the Therapeutic Products Act is not there to give effect to those, but never mind, we'll move on to the next point. Why are we doing this? The stated benefits of this is that, and they're well outlined in the regulatory impact statement, I think it's paras 14 and 16. The proposed changes emerged in the context of discussion around improving access to medicines. That is a very helpful discussion our country has had. The intent behind the verification pathway is to facilitate faster public access to medicines. However, as the RIS notes, the actual impact on medicines availability and access may be limited because in practice, after Medsafe approval, Pharmac funding is often required for this to be available at scale in our communities. And of course, this bill doesn't address that. So while it may speed up part of the process and reduce costs for pharmaceutical companies, it may not have a big impact on patients. I guess we won't know until we see how it goes. It's critical that the government clearly articulates the expected and tangible benefits of these changes, including which patient groups will be benefited. We look forward to having those conversations. One area where we do have concerns is the change of a technical advisory group into one where the appointees are appointed by the Minister. That is an area where we will be focusing our scrutiny in select committee, because that appears to create some possibility of conflicts of interest as well.
The member's time has expired.